So I've already checked my EMR. I've acknowledged my orders, which is placing in a nasogastric tube. So I'm going to go ahead and enter my patient's room. Good morning. My name is Diamond. I'm going to be your student nurse today from the University of Southern Mississippi. Will you go ahead and tell me your name and your date of birth, please? So my patient's name matches the MAR. So I'm going to go ahead. Do you have any allergies? No, so my patient has no allergies. So today we're just going to be inserting a nasogastric tube. This procedure should be fairly quick. You might feel a little discomfort, but I'm going to keep looking out for signs. Any signs of distress or cyanosis, if I see those signs, we'll go ahead and end the procedure immediately. So I've raised the bed to a working height. I'm going to go ahead and lower the bed rail. Okay, and then I've already placed my patient in high Fowler's. So I'm going to go ahead and wash my hands and glove. So the first step that we're going to do is I'm going to measure the nasogastric tube. I'm going to go ahead and just take it out of the package. I'm just going to wrap it around my hand to make sure that it doesn't sling around anywhere. Okay. And then I'm going to grab a piece of tape. Okay. So first I'm going to measure from the tip of your nose to your ear and then down to the xiphoid process, which is here. Okay. Now I'm going to go ahead and tape that. Okay, and then the purpose of this is just to ensure that I'm correctly inserting enough of the tube down to reach the stomach. Okay, so this process, I'm going to try to do it as quick as possible, okay? So first, I'm just going to go ahead and just lubricate the first 2 to 4 inches of the nasogastric tube, okay? And then I'm going to go ahead and I'm going to ask you to tilt your head back, and then when I reach the pharynx, you're going to put your chin to your chest, okay? And I'll let you know when it's time to do that. So I'm going to do this as quick as possible. You ready? On my count, 1, 2, 3. Okay. So I've reached the pharynx, so I'm going to go ahead and ask you to place your chin down to your chest, okay? Okay, so now I'm just going to place a piece of tape on my patient's nose, just to hold it in place, okay? And before I correct the placement, I'm going to go ahead and make sure that the tube is in the stomach. So I would do a portable chest x-ray, or I could aspirate the gastric contents and then test for the pH level. So now I'm going to go ahead and take this tape off and then properly fit it around the bridge of the nose. And I'm going to take another piece of tape. And then I would use a safety pin to put it down the patient's on the patient's gown to make sure that when the patient moves or turns, the tube doesn't go everywhere. Okay, and then do you feel any discomfort or anything? No? Okay. So now it's time. So I've checked my order. The physician has ordered some medications. So I'm going to re-identify my patient, check my MAR. I'm going to make sure that I check my 5 rights. So right patient, right route, right dose, right time, and right medication. So first I'm going to go ahead. I've checked all my 5 rights. I'm going to flush the nasogastric tube. Okay, I'm just going to flush the tube. I'm going to administer the medication, and I'm going to flush again. So now that I've entered the medications, it's been a couple days. The physician has ordered to remove the nasogastric tube. So the first step I'm going to do is I'm going to identify myself. Hi, my name's Diamond. I'm going to be student nurse today from the University of Southern Mississippi. Today we're just going to be removing your nasogastric tube. So can you tell me your name and your date of birth, please? So the patient's name and date of birth matches the MAR. So I'm going to go ahead. So today we're just going to be removing your nasogastric tube. So the bed is, again, to working height. So first I'm going to just go ahead and just remove the tape. So this process should be fairly quick. If you feel any pain or discomfort during this, just let me know. I'm going to be still checking for any signs of cyanosis. So I'm just removing one more piece of tape. Okay? And so now I'm just going to go ahead and remove the tube. I'm going to ask you just to go ahead and just breathe like normal. Are you ready? 1, 2, 3. Okay, so I removed the tube. Okay, I'm going to go ahead and cover my patient up. I'm assessing for any signs of distress. Okay, so I'm going to go ahead and put the patient's bed rails up. I'm going to lower his bed back down, put him in a semi-Fowler's position. Okay, so you have your call light next to you. Do you need anything else from me today? No? Okay, I hope you have a great day.